Employers are really using two key strategies today to rein in the cost of healthcare, and they're having some success. The first strategy really speaks to wellness. They're really trying to get people to take better care of themselves, and by taking better care of themselves, they'll need less healthcare services. Having said that, there's not a lot of strong evidence for many employers that it's having the impact they want it to have. In our own survey results, we find that 4 out of 5 employers don't even have evidence that they're having the impact that they intend for the programs. Because of that, there's an increased focus on creating a more accountable and a more effective way to measure the return on investment of these wellness programs, not just for the sake of measuring the return on investment, but also to tweak those programs in a way that they become more effective over time. The second key area that they're looking at is how people are paying for the services that they get when they consume health care. When people pay more at the point of care, they pay more attention to what they consume and often consume less. On the other hand, there are some concerns associated with it as well. You don't want people not getting the care they need. If they put off care they need, it could actually get more serious over time. And you also want people to make sound decisions between the choices that they make, and that's where transparency comes into play. When you think about these two strategies, wellness and consumerism, really getting people to own more of the cost of the care that they seek, those strategies aren't going away. You're going to see more and more efforts to move in that direction. So overall, I think what we have found is healthcare costs are increasing at a lower rate than they have historically. And when we look forward, we question, are we into a new normal? Certainly the incentives are starting to change in the system, the incentives in the benefit plans, the incentives in the provider compensation, and the incentives across the entire value chain. Over time, we want to have the best healthcare system in the world, absolutely, but we also have to have an affordable healthcare system, and costs can't increase even at the level that we're talking about today.